Should you consider taking antidepressants or explore alternative approaches from the psychopharmacological field for treatment? This is a query that numerous clients inquire about, whether a medication could be beneficial. In the context of my consultation, the conversational therapeutic component is the focus. If a patient now, for example, goes to a psychiatrist, i.e. a specialist in psychiatry, the focus is less on the level of conversation, but actually on the question, which medication does the patient receive? It is actually not so much considered whether a patient receives medication, but which one he receives. At the moment, there is currently a change in thinking because we are finding out more and more that science is always just the latest state of error, where we believe that medications work or can help, or where depression comes from, which is why our understanding is constantly evolving. And that is something that I actually consider to be very differentiated here in this particular practice. Reflect on what benefit can one draw or obtain from the use or administration of a medication. And it is not like you attempt talk therapy, and if it does not yield results, you simply resort to taking medication as an alternative approach. In fact, it is actually the other way around. One should possibly consider resorting to a medication, but one cannot be completely sure if it will work. And in any case, one should also find the way to the conversations. To answer this, whether a psychopharmacon, an antidepressant, to be more precise, can help you, one should weigh carefully because these preparations have an incredibly long list of undesirable drug effects. Dizziness, nausea, digestive problems, fatigue are commonly experienced symptoms in this condition. People walk around for days like under a cheese bell, and sometimes even with the rather lighter preparations like acetylopram, venlafaxine, and escitalopram. And one should also carefully consider for oneself whether or not one is willing to get involved in this potential side effect story and make an informed decision. Because traditionally, antidepressant medications take effect in individuals only after a period of 14 days to 6 weeks, resulting in a mood-lifting effect. And something that I encounter with the individuals in practice, above all, is related to this question of medication, specifically what the expectation actually is. Because if we give any psychopharmacological preparation in this context, there are different ones. There are selective serotonin reuptake inhibitors, there are tricyclic classical antidepressants, and so on and so forth. We are now going into the idea that someone takes a psychopharmacological preparation, I'll abbreviate it with M for medication. Then the question arises for me, why does someone actually want to take it exactly? He naturally states that I should experience an improvement in my well-being, and I desire to alleviate my depression. The only initial connection I perceive is that someone seeks to derive a certain form of resilience from it. Strength in order to rediscover his previous life, ability to handle a variety of things, perhaps also something like courage, to dare certain things once more. That implies a medication is ultimately a type of provider that grants me the power to resume living my life. And when we examine this cycle, I acquire strength to have the capacity to live my life once more. Let's revisit this question once again. Why did someone become depressed, for instance? Many people understand the term depression in a diagnostic sense. In Germany, we use the ICD-10 model, an American diagnostic manual, to differentiate disorders such as depression, mania, and anxiety disorder, for example. And many people understand the model like this: because I have depression, I experience depressive symptoms. Because I have an anxiety disorder, I experience anxiety. That's not what is meant. The diagnostic part for the F categories, i.e., everything that is also related to psychiatry or the brain, is always to be understood purely descriptively. Depression doesn't guarantee depressive symptoms. Anxiety disorder doesn't automatically mean you have fears. However, since we are able to observe different facets in an individual's life, such as those related to symptoms of depression or symptoms of an anxiety disorder, we are able to assign a specific label to these experiences. For instance, we can diagnose a moderate depressive episode using the ICD-10 code F32.1, or identify agoraphobia with panic disorder using the code F40.01. It is of utmost importance to be aware. Because we possess particular indications, we are able to assign it a precise diagnosis. But this does not provide any origin or statement about where this form of disturbance comes from. We should take a brief look at how a person actually slips into depressive patterns or anxiety disorder patterns. It is indeed true that our brain processes information primarily in a visual and auditory manner. This implies that we, as humans, primarily respond to what we perceive in our mind's eye and what we communicate with ourselves on an auditory thinking level. And there is another third point added to it. We have, as I said, just this visual level, the auditory level in mind, and then of course only this point of personal integrity, which is supposed to express to some extent we do the things we want to do and let the things we don't want to do also stay. If I get into an incongruence there and, for example, pursue a job that I actually don't want to do, then this incongruence will eventually lead to me having an increasingly negative feeling about it in my life. Above all, depression patterns in the sense of a person seeing themselves in their mind's eye, for example, becoming impoverished or constantly being thrown into failure. Or he converses with himself additionally in terms of, what if this goes wrong? What if I am unable to do it? What if I never find the job I desire to do? Here, at this level, we typically have the capability to identify the factors involved in a psychotherapeutic process that lead an individual to slide into patterns of depression. And that is precisely what we can ascertain here. An individual inadvertently infiltrates a life through these reactive mechanisms, which subsequently compels them, for instance, to undergo medication as a means of mitigating these patterns of depressive reactions. Ultimately, in order to possess the strength to return to his previous existence, which had caused him to experience feelings of depression. And this is a cycle where we would actually say that a person can no longer escape from this mechanism, constantly relying on a medication and maybe even having to take more and more and more due to tolerance development. An extremely significant process that an individual develops in such conversations primarily involves the question of what type of life they desire to lead in the future, so as to avoid being excessively entangled in these patterns of depression. It gradually explores how one's life is progressing. You can also take a quick look at the following ideas. Often it is just like that I meet someone, they come in and say, my current situation is stupid. I desire to escape from that. How do I accomplish that? How do I progress from my existing starting point? There are usually different mechanisms, target paths that we can take. Most of the time there are even more than just these three. And then the subsequent question arises for me, which one would be the correct one for me? And at this interface, it is less about how do I alter the situation. In what manner can I be of assistance to someone in changing the situation before we have even determined the client's actual desired destination? How would his life be good? Generally, our mind operates with a focus on achieving results, so if we can demonstrate it to him, that is the direction I aim to pursue. Great, good pics. Every great feeling correlates with a correspondingly great image. Big bad feelings have big bad pics. Great positive feelings have great positive pictures. And in the moment when you can demonstrate your brain, this is the place I want to go, that means you have defined your target. Does your brain usually also say, okay, I already know the way there? Then we have basically completed 7/8 of the distance. We want to apply this mechanism to this question as well. Should you take medication? If you desire to take medication in order to regain strength, live your previous life, and restore your former strength, you should reconsider and question the rationality of such a decision. Is it conceivable that in your previous existence, you also engaged in actions that ultimately led to the emergence of these patterns of depression? So you should instead ask yourself, if you take a medication to derive strength from it, what type of life do you desire to live in the future with the assistance of it? And if you then arrive at a reasonable response, it is possible that you will reach the conclusion that is rational for you. Yes, I would be interested in seeking a solution. I would be interested in giving it a try. And what often happens is that people actually feel for themselves, okay, I can do this without medication.
Have you already seen my most important video for you? You will learn to understand your symptoms and find the path to change. Feel free to also watch this video here. Like the video, subscribe to the channel, and activate the bell to always stay informed about the latest posts.